Rule number 1. Do not take any pills or any medication if you don't need them. Rule number 2. Refer to rule number 1. And rule number 3. If a physician or any prescriber is recommending a medication, always ask, why do I need to take this medication and what are the risks and the benefits? According to the World Health Organization, there will be 157 million Americans with a chronic medical condition for which they will need to take a medication regularly by the year 2020. Now, this is actually depressing because of the fact that people want to be healthy. Now, I believe as physicians, we should investigate the causes of non-adherence and support the patient in any way possible. But it so happens that patients do not take their medications as prescribed by their physician. Actually, 50% do not take their pills as recommended. That leads to a certain problem called medication non-compliance or medication non-adherence. It is actually a global problem, but numerous studies have been done here in the US, and this is a problem of gigantic proportions. I'm going to lay down some stats on the magnitude of medication non-compliance. 64% of all hospital readmissions within 30 days of a hospital discharge are related to issues with medication. As per the CDC or Centers for Disease Control, 20 to 30% of all prescriptions are never filled to begin with. And according to the CDC, 125,000 US citizens die each year due to not following the doctor's advice with regards to the medication. Only half the patients taking pills for high blood pressure actually take them properly. Only 43% of patients with asthma follow the correct guidance for the treatment of acute asthma. A quarter of all nursing home admissions are directly caused by issues with medication non-adherence. Now, as per the New England Healthcare Institute, approximately $290 billion are wasted on potentially avoidable costs due to medication non-compliance. Now, when I read the following, that a third of all kidney transplant patients do not follow the doctor's advice on how to take their anti-rejection medication. Now, that is serious, and any transplanted kidney or any transplanted organ for that matter is considered by the person's body to be foreign. And as a natural response, the body fights against this foreign tissue. And you have to take special medication called anti-rejection medication that suppresses this natural reaction. So this is interesting, as this is surely a high cost and value situation. Anyways, the bottom line is that a person should take their medication if it is absolutely necessary, and work on yourself in a holistic manner to reduce your dependence on medication. And it should be every doctor's goal to prevent you from taking medication. But if you have to, you must take them properly. Anyhow, better to have prevented high blood pressure or diabetes or lung problems, heart problems. But for one reason or the other, if you have a problem, find the best way to fix it. That would include dietary modification, lifestyle changes, healthier habits, and if it is unavoidable, then do yourself a favor and follow the advice of your physician, and do not become a part of the stats that we just talked about. So stick around, and if you do not want to miss any upcoming videos where I will also talk about how to stay on top of your medication, do hit the thumbs up button and like, and do subscribe. And if you have any goals for yourself about what we just talked about, then just let me know in the comments below. This is Dr. Khan signing out. Stay healthy and stay safe, and make America healthy again. Talk to you guys soon.